Hello everyone, I'm Daniel Steele and I'm coming to you from the traditional, ancestral, and unceded territory of the Musqueam people. And this lecture for SBPH 538 is going to be on vaccine passports, and it will cover the Maciure and Bisson paper from week 10 of the syllabus. All right, so vaccine passports, this is a little bit of a blast from the recent past, but obviously if you lived here in BC during the COVID-19 era, or maybe if you live somewhere else like Europe or the US or many other places where there are vaccine passports, this will be familiar to you. But in BC, in British Columbia, there were vaccine passports in place from September 13th, 2021 to April 8th, 2022. And this policy can be viewed as a kind of vaccine mandate of a sort, because it does require people to be vaccinated, or in the sense of imposing some kind of restriction on you if you're not vaccinated. And so let's dive into the ethics of these kinds of policies. And so in the reading, Maciure and Bisson really want to emphasize that when you think about the ethics of this issue of vaccine passports, that it's really important to keep in mind the context, the background that was in place. If you think, say, you're in the summer of 2021 when, and I guess the summer and spring of 2021 when this whole idea of vaccine passports started to be discussed, and an idea that was brought up in many different places and implemented in some places like BC. The background was one in which by, say, late summer or so, or mid to late summer, most people in Canada, or really almost all people in Canada who wanted to be vaccinated for the COVID-19, against COVID-19 could access vaccinations, right? So like myself, I was vaccinated sometime in the summer of 2021 for the first time for COVID-19. And so if you're over the age of 12 by then, you could be, you could be vaccinated for COVID-19 if you wanted to, if you're in Canada. But restrictions on non-essential public spaces, and these would be things like restaurants, movie theaters, sporting events, these were still in place at that time. So there were still a lot of restrictions on these things in BC. In some cases, this meant that these things like movie theaters just couldn't operate at all, or it meant that, for example, restaurants would have to operate at partial capacity, they couldn't be full capacity, and so on. And the idea then was that vaccine passports would enable these non-essential public spaces to reopen for vaccinated people to go to them. And so this would be a way to sort of relax some of the restrictions that were in place without sort of relaxing them too suddenly or too abruptly, and then risking some huge, spike in the number of COVID-19 cases. And that sort of was the rationale for having these policies. So it's against this backdrop, and Maciure and Bisson really want us to keep this backdrop, this context in mind. And against this backdrop, they ask, is it fair to grant rights and opportunities to those who are adequately vaccinated and to deny them, that is, those rights and opportunities to those who are not? And so this, of course, is a kind of equity or fairness question. And so one of the things that's really neat about the Maciure and Bisson paper in connection with the previous reading from this week by Naveen and Atwell is it's really illustrating the themes that Naveen and Atwell raise about how, number one, freedom versus population health aren't the only two concerns. There's also equity, for example, and that's one of the main issues here, obviously. And secondly, the details of the policy and the context of the policy when it's being implemented really matter to the ethics. And that's also a big theme, obviously, here in Maciure and Bisson's paper. So let's dive into this idea about equity. How is it that vaccine passports could be inequitable? Well, one idea goes like this. The idea is that, well, if you think about vaccine hesitancy, it's not just random. There's certain groups who are less likely to get vaccinated than other groups. And in some cases, these differences can track things like discrimination or a history of distrust with the healthcare system that might be linked to discrimination, say, on racial or other kinds of bases. And so the concern here then is that if certain groups who have, say, been subject to discrimination by society are less likely to get vaccinated, maybe because they don't trust the healthcare system as much, then those people will be similarly disadvantaged by a vaccine passport. And so I found it a little difficult to find statistics for Canada that were disaggregated by things like gender or race when it came to vaccine hesitancy. So here on this panel here, this is data from the US. So this is around 2020, 2021. And so if you further to the right is sort of more vaccine hesitancy, and to the left, here are the negative numbers, that's being more positive or more willing to get vaccinated. So if you look on the who's more willing to be vaccinated, things like tested for COVID-19, think the vaccines are safe, think vaccines are important, vaccines are effective. Unsurprisingly, these are things that would make people more willing to get vaccinated. If you look at factors that were correlated with people being less likely to want to get vaccinated for COVID-19, there's some interesting ones. There's being female was the one that was the strongest predictor here of vaccine hesitancy. Being Black in the US was associated with being more vaccine hesitant, and being a Trump voter in 2020 was also maybe unsurprisingly associated with being vaccine hesitant. But those first two, female and Black, those are ones that raise these kinds of equity concerns, because that would mean that the vaccine passports would restrict the freedom of these groups more than, say, of white male groups, and that seems inequitable. Okay, so McQuire and Bisson are in response to this kind of concern, trying to defend the ethics of vaccine passports, again, keeping in mind the context in which they were implemented. And their main argument uses a concept from economics called Pareto improvement. So if you've never encountered that before, the idea is really fairly simple. And a Pareto improvement is a situation where you change a policy to make some better off while not making anybody else worse off. So there's some people who gain and nobody loses. So overall, it's better than what you had before. And the idea here is that if you're thinking about the status quo, the situation before the passports, where you already had restrictions on public spaces that were not essential, again, like movie theaters, like restaurants, etc. Those are restrictions that everybody was subject to prior to the passports. Once the passports came into play, then those restrictions could be lessened. Like you might be able to open movie theaters again. You might be able to open sporting events again. You might allow restaurants to operate at full capacity, but on the condition that the people who to attend those events are vaccinated and can show the proof of vaccination, with their phone and the little barcode on their phone. And so the idea here is that the vaccine passports allowed for a situation where the people who were vaccinated had more freedom to attend public events, and the people who weren't vaccinated, well, their situation was the same as it was before. McQuire and Bisson say vaccine passports then in this situation are justified, but they have to have two conditions. First, that they're temporary, and secondly, that they infringe on fundamental rights as little as possible and don't restrict access to essential services. And those two things are sort of connected to each other. So let's look at these two ideas sort of in reverse order. So the first, starting with the fundamental rights and essential services. So McQuire and Bisson mention the right to work and the right to vote as fundamental rights. If you click that link, you can find more about the rights in the Canadian Charter. And they also mention healthcare. I assume they'd also think of grocery stores and education as also being essential services. And so the idea is that the vaccine passports were not, first of all, limiting anybody's right to vote. They weren't causing people not to be able to work. And they were only applied to things like non-essential things like restaurants, movie theaters, etc. And so the idea is that they weren't restricting people from essential things like healthcare or education or being able to buy food. In addition, McQuire and Bisson argue that it's really important that they be temporary. And the idea there is that if you were to implement a permanent policy of differing rights based on vaccination status, that would really create this really problematic sort of permanent division in society between sort of haves and have-nots on the basis of who is vaccinated. And that seems really problematic. It seems like you really should avoid creating permanent groups of people who are divided in terms of their rights. And even if there's some public health benefit of it, this is just something you really want to be very, very careful of. And so McQuire and Bisson say that the vaccine passport should be sort of phased out as soon as, in their words, as soon as allowed for by the epidemiological situation. And of course, like in BC, these were phased out in 2022. I think that's similar for most other places that did implement these policies. Okay, so let's then return to this question about equity, which remember was the main concern that was being raised about vaccine passports. So the concern was that, well, if there are different rates of vaccination among different groups, and those different rates of vaccination are tied to things like distrust in the healthcare system because of, say, discrimination, that means that this vaccine passport policy would sort of pile another disproportionate impact upon, what was already something that was inequitable. And that seems problematic. That seems like an equity concern. And so Maciure and Bisson recognized that issue. They recognized this potential for vaccine passports to be inequitable in their effects. But they say that you need to think about this in this larger context against what was the context at the time. And the context at the time was one where you had restrictions, lockdowns, all these kinds of restrictions on public spaces that were non-essential, like again, restaurants, movie theaters, etc. And the effects of those restrictions were far more inequitable than vaccine passports. So the idea is that moving to vaccine passports would be, in comparison to what was preceding it, a reduction in the inequities that were going on. And if you think about why that's so, well, it's well known that COVID-19 restrictions tended to disproportionately impact people with lower incomes. So if you worked, say, in a restaurant, if you worked in any kind of service kind of job, obviously COVID-19 restrictions and public social distancing and all these kinds of things are really going to impact, your income and might make life very difficult for you. And so by allowing more people to be sort of free and go about their business, this allowed these sort of the economy to sort of open up again and allowed people to go back to work. And so for low-income people whose jobs might be in the service industry, this was really important. And of course, that would also allow anyone who is lower income or in any other way disadvantaged and vaccinated to just sort of access all those things more freely themselves. So the idea is that compared to this prior situation, it was an improvement as far as equity was concerned. And so the idea here then is that Maciure and Bisson are suggesting that vaccine passports are a good approach so long as completely lifting the restrictions would be too risky given the epidemiological situation. In other words, the idea is that if it's judged to be like, well, we don't want to just get rid of all the restrictions all at once because we're afraid that the cases of COVID-19 would just skyrocket and like the hospitals might be overwhelmed, et cetera, et cetera. If you're really worried about that and you think, we don't want to just scrap all these restrictions all at once, then the COVID-19 passports were a sort of reasonable sort of compromise that was imperfect, but maybe the best you could do in this situation. So I want to just wrap this up by thinking about a connection potentially to a different case, namely the one about vaccinations and enrollment in public schools. And as noted, this is something that exists in many states in the US, and there's also some provinces in Canada that have these kinds of rules. And one of the things that's interesting is that they don't seem to follow these two criteria proposed by Maciure and Bisson. That is, they're not temporary because these things are basically just sort of permanently in place. So they're permanently creating a difference between children who are vaccinated and children who are not vaccinated in their ability to access public education. And that they that they also seem to target something that is arguably a fundamental right, namely the right to access education. And so that might raise questions about, well, are these kinds of policies justified? And that's something we can discuss in class and we can think about more then. All right, so to wrap up this lecture, the main thing I want you to take away is that this article illustrates how equity and contextual details can be really important to the ethics of vaccination mandates. So one way to think about this in terms of a very direct and practical way for yourselves is that if you're thinking about writing a final paper for this class about vaccine mandates, you really want to keep this idea in mind. Focus on a concrete case, and I think the Maciure and Bisson article gives you an example of how you might do that sort of thing. And their discussion also raises these ideas that are potentially relevant or at least interesting to talk about for other examples, like vaccination and enrollment in public schools and whether that's ethical or not. So that's something we can talk about in class. All right, so I will see you all soon, and bye-bye for now.